Hi, so glad you can join us. I'm Dr. Jane Georges, and I'm Dean of the Hahn School of Nursing at the University of San Diego. Today is National Healthcare Decision Day, and I can't think of a more important topic to consider during our current COVID crisis. In this program, we will have two of our USD nursing faculty talk about the importance of having a medical directive in the time of a pandemic. We know it can be difficult for families to start these discussions, and we'd like to provide you with a framework and perhaps answer any questions you might have regarding this important communication between families and healthcare providers. Our presenters are Dr. Eileen Frey-Bowers. She is currently Associate Professor at the Hahn School of Nursing. She's a pediatric advanced practice nurse and also an attorney. Secondly, we have Dr. Carolyn Etland. She is a hospice and palliative care advanced practice nurse with many years of experience in this area. She also teaches in this area in our School of Nursing, as does Dr. Frey-Bowers. We hope in the presentation to follow that you'll learn some ways that caregivers can communicate with families about this important issue, especially at a time in which stress is so much a part of our lives and uncertainty. Thank you for joining us.
Well, good morning, everybody. Thank you so much for joining us on this beautiful San Diego day. I think that this is one of the first times that we've been able to offer something like this online, but times are different, so we're going to roll with the different times here. So I'm going to share my screen with you, and just be advised that I'm going to switch back and forth between a couple of different screens as we move along in our talk. So today we wanted to do a webinar on advanced directives, and we titled this "It's Time to Act" because it seems like a really, really good time to talk about this topic. Today is National Healthcare Decisions Day. It's in April every year. And of course, this is being hosted by the University of San Diego Hahn School of Nursing and Health Sciences. I'm Dr. Caroline Etland. I'm an associate professor for the School of Nursing, and also K.M. Waltman and Melissa R. McGuire, Hospice and Palliative Care Fellow. And joining me today is Dr. Eileen Frey-Bowers, who is also an associate professor, colleague here in the School of Nursing. And she's affiliate faculty with the College of Arts and Sciences and Biomedical Ethics. And she has a background clinically in pediatric intensive care. Would you like to say good morning?
Good morning, everybody.
And then also joining us is Carol Simone, who is our Director of Communications and Events here at the School of Nursing. And she's going to help us field the questions as we move along in our webinar. I think everybody is muted right now, and there may be an opportunity later on to unmute, but there certainly will be an opportunity for questions and answers. Forgive me for talking to those of you who are familiar with Zoom and webinars, but I wanted to briefly cover how you ask a question. And if you have your computer screen up and you use your cursor to hover at the bottom of the screen, you can see a chat button down here in the black bar. And if you click on that chat button, over here will open another box, and you can type your question in the bottom and just click enter. And your question will appear, and as we get towards the end of the presentation, we'll be able to see your questions and then to answer them. So thank you for doing that. We appreciate your thoughts on this. So I think of this as being a common purpose that we all share outside of the times of this crazy pandemic. We all have learned that we have to have different ways of communicating with our healthcare providers, doctors, nurses, and so forth, as well as talking with our family about what our health issues are. So today we wanted to talk about the different parts or the different elements of what an advance directive is, and then talk about the steps for completing an advance directive. There are a number of resources that are out there on the internet, and California has really led the way for a lot of these resources. And as I mentioned, as we go through the slides here, we're going to stop for a moment and go to some of these websites so you can see firsthand what I'm talking about. We will leave you with the resource list when we post this on the website. So that'll make it easier for you to go back. So it really is the time to act right now. Again, the global pandemic has created a lot of concern and a lot of fear, and certainly there are many of us who have lost friends or loved ones in the pandemic. But outside of a crisis like this, there are many, many people living all over the world who have different kinds of chronic illnesses. And some of these illnesses advance as time goes by: heart disease, cancer, lung disease, kidney disease, and so forth. And with the chronic illness during normal times, we have time to think and plan, and conversations that will progress over time depending on what's happening. And it's really important to write down wishes so that if our loved ones have to speak for us, they'll know what we want. They'll know what's important to us. And it really does free them from the burden of having to guess, and it frees them from any sense of guilt they might have about making a decision. So that's one gift that we can give to our loved ones. So National Healthcare Decisions Day actually came about way back in 2008 when a Virginia lawyer named Nathan Kotkamp became concerned in talking with his clients that there were so many opportunities that were unmet, so many situations where people were hospitalized and they were critically ill, and it was very difficult for loved ones to know what to do. So he decided that he wanted to create some easy to understand, consistent tools, not just in advance directive forms, but the tools to be able to discuss this and make it easier for people. Because most of us aren't lawyers. Most of us in America aren't nurses or doctors. So we have to have some common ground to talk about these things. And so our loved ones would know what our wishes are in our last days. And numerous studies have shown that 90% of Americans believe that it's really important to have an advance directive. Yet consistently in study after study, only about 30% of Americans will actually complete one. So there's huge opportunity here. I think that one of the ideas that I wanted to bring into the conversation now that's so very important is the idea about quality of life. And many of us may be familiar with that term, but quality of life is individual to each person. And once a conversation starts, people really start to think about what parts of my life produce quality of life for me, and are those things more important than quantity or length of life? So in 2010, a writer named Ellen Goodman was having a conversation with friends of hers, longtime friends of hers, and all of them had cared for loved ones during serious illnesses until their final days. And what she realized and what her friends realized was that with the same thing that, that Nathan Kotkamp realizes, we have to give people tools. And so in working with a number of experts and colleagues, and then in collaboration with the Institute for Healthcare Improvement, the Conversation Project was created. And I want to take you there for a moment. So the Conversation Project actually helps people to access the tools, helps people to have the conversations. And when you go to this website, there's a number of starter kits. And what's key about these starter kits is that they're very easy to read. And they come, look at all the languages they come in. So really, this is not something that's exclusive to people who speak English only. We know there's a lot of cultural differences in people who from countries that are not the United States of America. And so we need to have tools that are available that are sensitive to what people experience in different cultures. So these conversation starter kits are available free of charge. You're supposed to use them. You're supposed to share them. and this is the location in which you will find them. And there are others as well. So let's go back to our PowerPoint. There we go. So that's the conversation project, and we'll refer back to that in the future of in the coming slides. So again, starting the discussion can be difficult, and some people are not familiar with what some of the terms are that are used in a lot of these tools. And indeed, when somebody's admitted to the hospital or when somebody goes to a new doctor, they may be asked, do you have an advance directive? Or who's your healthcare proxy? And so we wanted to provide you with information about the different definitions. And you can see on the right of the screen here, the healthcare proxy is a person that you choose, who you will have a good conversation with about what's important to you. So for example, my brother is my healthcare proxy. Another term that's used for that is a healthcare agent or a power of attorney for healthcare. And a power of attorney for healthcare is a little bit different. Dr. Frey-Bowers will be talking about how that's different from a power of attorney for finances. So a healthcare proxy can also refer to a document, such as a proxy or an advance directive. So using these multiple terms can be a little bit confusing. So it's good to have a visual of what they mean, that the meanings that are exactly the same. So as you start to understand the terms and you go to have a conversation with somebody, before that, you need to think and reflect on some key questions that only you can answer. You know, who's the person that knows you best? Who could speak for you if you can't speak for yourself because you're very ill? And who is it that would honor your wishes? I have a friend who has a sibling, and he does not want his sibling to make decisions for him if he can't speak for himself, for a variety of reasons. It's not that the sibling's a bad person, it's just he doesn't believe that the sibling would be able to carry out his wishes as he wants them because of the emotion that's involved. So another website that I'd like to go to is the Coalition for Compassionate Care of California. Now they have a huge amount of resources. There, again, just like the Conversation Project, there's conversation tools that are in English and Spanish. There's a starter kit. There's really helpful phrases. Sometimes we just can't think of the words to start with. So if somebody gives us an example, we can alter the example just a little bit so it's comfortable for us to say it's in language that makes sense to us. There's also advanced directives forms here. There's information about healthcare agents and decision-making capacity. So those are important things to be able to access. So that's here on this website. In addition to those resources, there's a number of other resources to explain some of the terminology and some of the decisions that people might have to make. So I like visual aids, and I think it's really helpful with a complex topic like this to break it down into different pieces. For me, that's kind of a common sense way to go about it. And so in the beginning, in the first step, is to recognize the importance of having an advance directive or an AD. And it really is a gift to loved ones. It's something that you can do. And I think in our pandemic crisis right now, we've felt a loss of control over a lot of things. And this is one of those things that we can take control over that will help us in the future, no matter what our future is. But it will help our loved ones when we're having a medical crisis. And the best time to complete these advanced directives is when we're not in a medical crisis, when we're not in an emotional state or medically unstable. The second step is to gather information. So if you have been diagnosed with any kind of illness, it's really important to talk with your healthcare providers, with your doctor, with your nurse practitioner, your PA, and be able to say, what does this illness mean for me long term? We know that things are under control now, but how could things go badly? What might be some crisis that can happen? So that's one way of gathering information. Another thing you can do is to download a sample advance directive from your state. And you saw a couple of websites just now that give samples of advance directives. And Eileen's actually going to bring you to a website to talk about some advanced directives from the state of California. Step 3 is to identify somebody to be your healthcare proxy or your decision maker. And really, it's important to ask if they're willing to do that, because not everybody is. It really is quite a responsibility, and somebody has to agree to that. And it's really important to select the right person that you trust will follow your wishes. If you download one of these conversation starters or advanced directives toolkits, then you'll see that there are recommendations about being able to talk to your proxy and the steps that you need to go through. And this is not just filling out a form and you're done. This is a process that happens. And as we go by year to year, as we experience different medical situations, then we have to update our advanced directives and see if, yeah, that's exactly how I still feel, or no, I've changed my mind on that a little bit. And so the next step is to communicate, give copies to our family members, give copies to our decision makers, and most importantly, give a copy to our doctor. When you come into a hospital for any reason, it's incredibly important to have a copy of the advanced directive so that can be put into the electronic medical record. And in San Diego, we're very fortunate that we can share some information about people's advanced directives if somebody, for example, would come into the emergency room where we don't usually receive care. So that can be very helpful as well. And then to review and update these regularly. So let's talk about a couple of examples. And this is an example. This wouldn't apply to everybody, but some of the reflection that should happen and the conversations that should happen with your loved ones and your decision maker is to talk about the things that matter most to me. Let's go back to quality of life. It's really important to say, these are the things that I personally need for a good quality of life. It's very, very important to have a lot of time to socialize, time to spend with my family. I want to be able to move around freely, walk, go wherever I want to go out to eat, and just enjoy things with friends and family. If I was really sick, things like cooking, music, gardening, taking care of my pets, walking my dog, those things would still be pretty important, and I would strive to get back to those things. But if I was sick, the kind of important things like work, work falls down the list of priorities when you're sick, and being able to travel broadly or being able to drive, those are things that I might think, I'm a little more willing to give that up if it means I can continue to have some independence. So with these things, they're going to be different from person to person, but these are really things that people understand they enjoy and what their priorities are. So in starting a conversation, having a conversation with somebody, it's really important to think about those you have known who have been very sick and what are the kinds of things that provided good quality of life for them. What were their priorities? So let's look at a few examples here of preferences. And in the blue writing, the purple writing at the top, these are examples of things that may be happening at present. If I was diagnosed with cancer, I would want treatment to cure my cancer. I would want treatment to slow my disease. If I had to go in and have a hip replacement or a knee replacement or some kind of surgery to correct something, I might not be able to take care of myself at home, so I might have to stay in a nursing home temporarily. If I was in an accident, absolutely, I would want somebody to give me recuperative care, aggressive intervention. I would be willing to be in an ICU. And if I had to be on a breathing machine temporarily, that would be okay. And temporary is kind of the key word there. That would suggest that I have a reversible condition. So I would want aggressive treatment for some kind of reversible condition. And if we fast forward into the future, if I had some kind of serious illness that might eventually be the cause of my death, my preferences might be really different. I might realize I don't want to be on a breathing machine, or I don't want CPR, but you know, maybe if I have to have a feeding tube temporarily, I would agree to that. Maybe if my kidneys were stressed and having a problem, I would agree to dialysis temporarily. It's really an individual decision. But what would be most important to me is that who's ever interacting with me and taking care of me treats me with respect and dignity. I would like some time with my family. And, you know, if I was seriously ill, I would want to be kept comfortable more than anything, even if that means I was sleeping more, even if that means I was not able to get out of bed as much. And I'll give you a good example. I want to tell you a brief story. I have a good friend whose mother had advanced Parkinson's disease, and this was probably about 10 years ago. And her mind was completely intact. She could make her own decisions. She had a good quality of life. She ate very well. She socialized with her family. And with the Parkinson's disease, she fell down a lot because she had advanced disease. And one of the times that she fell, unfortunately, she really hurt herself. She didn't break any major bones, except she broke her jaw in a couple of places. And I got a frantic call from my friend who was with her mother in the emergency room. And she said, I don't know what to do. The doctor came in and said, you know, you don't have any injuries that you can't recover from, but we do need to take you to surgery, and we need to wire your jaw shut so that your jaw can heal and you'll be able to resume eating in about 6 to 8 weeks. And my friend said that the surgeon told her, we have to put a feeding tube in you. And my friend's mother was appalled and upset and fearful because she had had a conversation with my friend to say, I don't ever want a feeding tube. Let me go if it's my time. I've had a very good life. And so we talked about, what does this feeding tube mean? Is it a temporary or is it a permanent condition? Is it an indication that her health is declining, or is it something that she can heal from? And that really helped the situation to look at it from that perspective. It sounds in retrospect to us like, oh, well, sure, that was an easy decision to make. But when you're in the middle of it, it's a difficult thing. So needless to say, she had the surgery, she got her jaw wired, she had her feeding tube, and she gained 15 pounds by the time her jaw had healed itself. So she was actually a pretty happy camper. But that's an example of how you can state your wishes, and sometimes unexpected things happen, and you have to make a temporary deviation from that. So what I'd like to do now is to turn over the presentation to my colleague, Dr. Freibauers, and she's going to continue on and talk to you about some more details regarding the advanced directives forms.
Thank you, Dr. Etland. Dr. Etland mentioned at the start of our presentation today that I had a background in pediatrics, and I wanted to make sure that we did not ignore that population in discussing the issue of advanced directives. Particularly young people that live with serious medical conditions also need the opportunity to determine what kind of care they would like to receive. Clearly, it's going to be tied to the child, adolescent, or young adult's developmental and cognitive status as to how much they might be able to contribute to this conversation, but they absolutely should be a partner in this type of a conversation. They have the right to determine the kind of medical treatment that they want and do not want, how they would like to be comforted and supported and cared for. They also have to be able to share information with their family and friends that they would like them to know about themselves and how they would like to be remembered. When young people have serious medical conditions that are potentially life-limiting, it truncates their development. It limits what they can hope and dream. And by including them in these kinds of conversations, we can give them some autonomy, we can give them some power back, and they can have an important role in determining their legacy. So it's very important that children, adolescents, and young adults that are in these kinds of situations, that they have that opportunity to talk with their parents, their providers, their friends, other family members. This kind of a conversation needs to occur with this group as well. The other group that it's a little bit more challenging to have this conversation with are our healthy adolescents and young adults. Oftentimes, they, as a parent of two of them, I know this, they live life with this invincibility, and they don't necessarily consider the potential of, being in an accident or having an acute illness that also might require some decisions to be made. And so it's very important for families to have conversations, even among healthy individuals in the family, to really understand their value system, what it is they hope for their future, and what kinds of treatments they would want that are related to those hopes for the future. And, just like Dr. Etland was explaining earlier, perhaps they would support the idea of certain invasive types of treatment if they were temporary, but if they were more long-term, that might be something that they would want to think long and hard about because it might alter their perceived quality of life. So we have to be having these conversations among all of our family members, not just our older folks, not just our folks with chronic illness. And as Dr. Etland said, it really is a gift to your family to be able to have this conversation and let them know, so that they're not in a time when they're dealing with emotion, perhaps grief, other types of considerations at that time, that they actually can feel like they are doing something that their loved one would want. Okay, let's go to the next slide here. So one of the things I wanted to speak a little bit more about was the idea of these different types of advanced directives. Oftentimes, as Dr. Etland pointed out earlier, we hear different terms: healthcare proxy, healthcare agent. We also hear different terms such as living will, durable power of attorney, and advanced directive. And so I wanted to clarify exactly what these are, particularly in California. It's important to understand that each state has a different process for advanced directives. They call them different things, and there are different laws around the implementation of each of these in each state. And so it's really important to make sure that you're aware of your state, so us here in California, but also if you have loved ones that live in other states and you want to assist them with this kind of decision-making process, you want to become familiar with the laws in that state. So you may have heard the term living will in the past, and living will is exactly what Dr. Etland was just talking about in terms of making your wishes known, what kinds of care somebody would want done for them should they be unable to make those decisions for themselves. They can list out the types of care that they would like, how they would like to be comforted, what kind of pain management, and so forth. That just sets aside your wishes. The legal power to make decisions for somebody to ensure that those wishes are met comes through what's known as a durable power of attorney for healthcare. And this is, you're basically naming somebody who will make those decisions for you should you not be able to make those decisions. And the durable power of attorney is for healthcare is only affecting healthcare decisions. It is not giving somebody the power to take over your finances or to take over other aspects of one's life. Those are a different type of power of attorney. And if somebody wanted to take care of that at the same time as developing a durable power of attorney for healthcare, they would need to go speak with somebody, an attorney who specializes in end-of-life care planning, and that can be done, but they are separate documents. In California, the California Advanced Directive, the Advanced Healthcare Directive, actually combines the living will and the durable power of attorney for healthcare. It is one document that you can find on the Attorney General's website. And if you follow the process and fill out that form, you will be completing a living will component, so you'll be able to list out your wishes, And you will also name a durable power of attorney for healthcare. So I'm just going to show you that website. And as you see, this is the Attorney General's website, has end-of-life care planning, and we can see that there's a lot of information on this website. It has an end-of-life checklist. You can click on the links that will provide you the California state form for the Advanced Care Directive and so forth. It will also provide you with some information regarding should you want to take care of financial issues at the same time. So those are the different types of advanced directives, but in California, if you follow the form that is on the California Attorney General website, you will take care of both that living will and that durable power of attorney in one fell swoop. It's important to remember that you don't have to use the form on the Attorney General website. There are many different forms that can be utilized. The nice thing about the California website is that it's all together, and you have certainty that it conforms to California state law. There are other types of medical directives that are important to understand as well. We have in California something called the Pre-Hospital Do Not Resuscitate Order, and we have the Physician's Orders for Life-Sustaining Treatment, or the POLST form. So for somebody who has a significant illness, a serious chronic illness, and they are concerned about whether or not they want CPR or they want other significant measures taken to extend their life, they can go ahead and talk to their healthcare provider about filling out a POLST form or filling out a Pre-Hospital Do Not Resuscitate order. It's very important to understand that advanced directives are instructive to your family, they're instructive to your healthcare providers, but they can have limited legal reach in that if you are found, maybe you're at your apartment or your home and you have an emergency and somebody calls 911 and the paramedics arrive, if there is not somebody around to say you have an advanced directives and you have an advanced directive, the emergency medical services team is obligated by law to resuscitate you. So unless you have the DNR order or a POLST form, they must do what they would do for anybody, and that's institute life-saving measures, and that may conflict with somebody's desires. So you can go ahead and speak with your physician about completing a POLST form or completing a DNR. Both of these can be honored by EMS because these are in fact physician orders, and so it gives guidance to EMS. It's particularly important for individuals who maybe live alone and they want to make sure that their wishes are carried out should they, should no family be around when they have an emergency. The next thing that's important to think about is we have a lot of older folks who, or individuals who maybe spend some of their time in different states. And as I mentioned, the legal requirements of the states can vary as to the type of form, the requirements, and so forth. So it's really important to make sure that somebody just has one advanced directive, and that form should meet the legal requirements of the state they spend the most of their time in. Do not create a different form for each state. That can create legal difficulties down the line. And so you just want to make sure that you have a form that meets the legal requirements of the state that you spend most of your time in. If the state that you spend another part of your time in has stricter requirements, you can always add those to your other form as well. But you just need to have one form. As I mentioned, people with serious medical conditions should discuss their condition with their doctor and complete the POLST form. Also very important to make sure that this is available, easily found. Again, should you be in a situation where emergency medical services needs to understand your situation, oftentimes we recommend to families, put it on the refrigerator, put it in the kitchen, someplace where EMS would easily find it, and EMS knows to look for that. Again, we want to point out the Coalition for Compassionate Care website, again, provides a lot of the tools for talking about advanced care planning in California. One of the things we get asked also is, once you've made an advanced directive, is that in stone? Can I change it? And yes, you absolutely can change it, and you should change and update it, because as your life changes, your needs and desires and values may change as well. There's a mnemonic that is suggested, and that's called the 5 Ds. And those Ds are: think about your advanced directive every time you reach a new decade in life. If you experience the death of a loved one, that's another good time to look at your own advanced directive. If you divorce, I like to think of this maybe as more of a change in marital status. So for our young folks, if they get married, that's a good time to think about their advanced directive. If you are given a new diagnosis of a significant medical condition, again, this is a good time to think about your advanced, your directive, and to ensure that it represents what you would want done for yourself. And then along the same lines, if you start to suffer a decline in your medical condition or cognitive functioning or something along those lines, you would want to think about updating your advanced directive to ensure, again, that it reflects sort of the things that are of importance to you at that particular stage in life. When you complete your advanced directive, you want to make sure, when you update it, you want to make sure that you give those updated copies to, again, your provider, your family members, so that they can understand that you've made some changes. The other thing that I want to point out is, when you are filling out that form, that advanced directive form, whether it be a California from the California Attorney General's office, or whether it be another form that's provided through one of the links that we will give you, there are some legal things that have to be done. The form needs to be witnessed by 2 people, or it needs to be notarized. If you have witnesses, only one can be a family member. The witness also cannot be the same person that you've named as your healthcare proxy. It cannot be your healthcare provider, and it cannot be an employee or operator of a community, residential, or healthcare facility. So you do need to think about who could be your witness, your 2 witnesses. Only one can be a family member. If you cannot find individuals to witness the document, your signing of the document, then you can have a notary sign it. And interesting fact, the notary folks are still out there working during this time of COVID. I actually had an experience with one earlier this week. Their national organization has provided them with all kinds of guidelines on how they can safely come to somebody's home to notarize important documents during this time of social distancing. So if this situation, this COVID-19 pandemic, has finally motivated you or a family member to complete an advanced directive, and you're concerned that you don't have witnesses given this time of social distancing, please know that there are notaries out there providing that service at this time. As we mentioned, you want to keep a copy at home in a visible place. Again, the refrigerator is a great place. Give a copy to your doctor. Anytime somebody is hospitalized, they should bring a copy, and the hospital itself should be asking you whether or not you have an advanced directive, so that you can trigger to remind you to bring that. And then also, if you have a post, you can register in San Diego. So again, so that emergency medical services is aware of that as well, and we can make sure that your wishes are honored. And lastly, individuals who do get a DNR form or a post order, they're encouraged to wear a medical alert bracelet. And there are actually three authorized vendors for the state of California on the type of medical alert bracelet that can be honored. And so we will provide you with that information as well. And I think I'm going to turn it back over to Dr. Etlin to address some of the training that we do at University of San Diego Hahn School of Nursing with regards to preparing our nursing students and our nurse practitioner students for the care of and talking about these, having these conversations with their patients.
Thank you, Eileen. That was a really good amount of information, and hearing the specifics, even those of us who have been in healthcare for a while, it is important to hear those specifics that helps clear up different terms and so forth. So in looking back to coming to a close here, I just wanted to talk about what are we doing in the School of Nursing. And almost all of our students have training in managing serious chronic illness, as well as how do you take care of people and how do you address needs, concerns, provide nursing care to people who are at the end of life or people who need palliative care. And indeed, our nurse practitioner students are taught to have an advanced directives or a pulse conversation. They get some very good training in that and get to debrief on that to learn more. But all of our nursing students learn to listen to the patients' and families' wishes in every course, and learn to be the advocates so that their voices can be heard in a medical crisis when medical decision making is occurring and people need to have conversations and need to work with healthcare providers to find the best course for that individual. And I see that we have quite a few people on our phone call here, and one of them is the director of our nurse practitioner program, so maybe she can add some more to that when we go into questions and answers. So we've arrived at the point where we can take some questions and answers, and so I encourage you to use the chat button to be able to ask questions about the material that you heard or even something that you didn't hear. Any questions? I know that both Eileen and I are available to answer questions in the future if people spend a few moments digesting or reflecting on this information. We can be reached at the emails for University of San Diego, and we'll certainly post those inside the resource list that Carol's going to post on the webpage.
Well, I'm going to jump in and start with, I'm going to ask a question and then answer it because it is a question that I get asked often about advanced directives. And that's the question of whether or not they are legally enforceable documents in a healthcare setting. So if somebody has an advanced directive, are the healthcare providers obligated to honor that advanced directive? And so it's a little bit of a fuzzy area in some regards. Yes, healthcare providers, the advanced directive is legally recognized, and providers are expected to respect the wishes of a patient if they've been documented in an advanced directive. But providers can refuse to comply with what is outlined in an advanced directive if they have, and if they or their institution have an objection of conscience, or where the wishes would be medically inappropriate. They do, however, if this becomes the case, they do, however, have an obligation then to work with the family to transfer that patient to a place where they could get care that would be able to be more consistent with the advanced directive. This is with regards to if there's a conscience objection. But it can be quite challenging to manage this. So it's really important that individuals have conversations with their providers, with their family ahead of time, and make sure that everybody is on the same page about the wishes. And if there are any questions or concerns, perhaps related to faith beliefs, things like that, that they pull in those folks, their clergy person, you know, and include them in the conversation as well, so that everybody can be on the same page, so that there are not these challenges that make difficult situations even more difficult.
So we have a question in the chat box for Dr. Fry-Bowers. I know that Tina Martin had posted a question about whether or not Dr. Fry-Bowers is available for consultation about advanced directives.
No, I am not. However, I can provide the individual who asked the question, I can provide them with resources on who they may be able to speak with from, I'm assuming they're looking for legal.
Yes.
Yeah, I can provide some resources to where you might be able to find, but I do not provide that.
Thank you. Thank you. Good to know.
And Dr. Mayo, Ann Mayo's on the line, and she shared some information with us about the University of Washington that has advanced directives specifically targeted to people who have a diagnosis of dementia. And I think that Eileen had talked about the need to discuss advanced directives with adolescents and children. And so this is an incredibly important point, that there are special populations that there are tools for that may be really helpful that are specific to that population. So for dementia, we can, if Dr. Mayo would send us that link, we'll put that on the resource list. That would be awesome. And did you want to say something?
Well, I just wanted to say, first of all, your presentation is absolutely excellent. And I learned a lot during the last 45 minutes. So thank you very much. In terms of dementia, these are meant to be filled out, you know, prior to someone, you know, getting too far advanced. It could even be filled out today when someone is cognitively normal. And they give talking points as well as a form that takes the family. You're supposed to do this with your family or whoever your loved one that you're partnering with. You go through this, but there's different decisions to be made as to whether, kind of like your hourglass, Dr. Etlin, that you had. So if I'm in the mild stage, what would I want to be done? If I'm in the moderate stage, and then if I'm in the advanced stage. So very similar. But there's an entire website and group at University of Washington that's coordinate a lot of information. So I'll get that link to you.
That would be wonderful. And I'm sharing my screen now. With dementia in particular, that's a pretty predictable course of illness. So it's incredibly important to be able to have the right conversation at the right time. And I think that most of us don't work in the behavioral health or mental health specialty, but I wanted to take you back to that population for a moment. And the Coalition for Compassionate Care of California actually has resources for people who have serious mental illness under their advanced directives forms. And making a plan and thinking ahead was a community-based effort up in the Santa Cruz area to be able to create a workbook for people who do have serious mental illness and really do want to have their wishes known. So that's available to you as well. So thank you so much for sharing that with us. And Annie has a question. I think that maybe we'll take one more question after this, and then we'll close. If the durable power of attorney for healthcare representative is not available during a crisis, then can that representative be contacted by phone to offer advice on patient preferences? And yeah, I think hands down, yes.
Yeah, it is going to depend on state law. So you would want to be familiar with the laws in each state with regards to how those can be implemented in those situations. So given that we have folks that are from around the, living around the country, I really want to encourage them to look at their state specific laws on several of those more specific implementation details, because it does vary.
Mm-hmm. And that actually brings up the point also of what if there is no advance directive? And so that's why the conversation itself is so important. And, you know, perhaps if there's no form completed, the person who knows the patient best is the person that the healthcare providers may speak with to find out their values, to find out the things that would be acceptable to them or not acceptable to them, and, you know, to substitute judgment on that.
And I think that's why this conversation is so important, right? Because we don't want individuals to end up in an intensive care environment or an emergency room where you have family members who have different perceptions about what an individual might want. And then it creates conflict and hard feelings at a time of great stress, and it just adds to this stress. So again, you know, being able to have this conversation, be able to document this conversation, and be able to select somebody who can speak with one voice to the healthcare team to provide information on the patient's wishes is incredibly important to ensure not only that the person gets the care that they would want, but also so that the family is not left dealing with you know, fractured relationships following dealing with a stressful situation.
And certainly if you've worked in a hospital, you've probably seen that before. So it is all about communication, and we do the best that we can do. And as we learn more, we try to put that learning into important relationships and in conversation. So I want to thank you all very much for attending today, and we will post a list of resources on the website for you. And I want to thank Dr. Fry-Bowers so much for all of your expertise and wonderful information, and just for being a great colleague.